Right. I want to welcome everyone who is joining us this evening. Welcome to our Doctor of Physical Therapy virtual information session. We are pretty much ready to get started. I don't really see any other attendees registering or joining us right now. So I will go ahead and start off with introductions. My name is Tammy Trainer, and I am one of the senior assistant directors of admissions here on the Worcester campus. And I work closely with the School of Physical Therapy as it relates to admissions and the application process. We're also joined by a member of our faculty as well as two current students. So we'll let Dr. Powers introduce herself and then we'll hear from John and Vincent.
Excellent. Thanks, Tammy. I'm Dr. Gina Powers. I teach largely in the first year of our new curriculum as part of the musculoskeletal team. My background is in orthopedics. I've been treating as an outpatient PT for the past 20 plus years. So that is me. Good to meet you all.
I'm John Fitzpatrick. I'm a first year PT student. I'm not a pathway student. I did 4 years undergrad and then I came here.
Hi everyone, I'm Vincent. I'm a pathway student. I'm a first year PT student here. I'm originally from Rhode Island, and since I was a pathway student, I went to the MCP campus on Boston for undergrad.
All right. Thank you all so much. So, a couple of just a housekeeping thing I want to mention. If you have any questions during this presentation, if you can please put them in the Q&A section at the bottom of your screen. You should see something at the bottom that says Q&A. If for some reason you're not able to find that and you're having difficulty, you can also put your question in the chat and then we'll be sure to answer it for you. Okay. All right. Well, let's go ahead and get started. So I want to go over a couple of things in regards to our university. Did you know that our university, MCPHS, has 100 programs spanning the healthcare space as a comprehensive healthcare university? So that means every single program that we offer on our campus is related to healthcare, which is great because healthcare is definitely our focus throughout our university. Did you also know that employment for physical therapists are projected to grow 14% from 2023 to 2033? So it is definitely a fast growing career in healthcare. Also, it is important to know that about 13,600 openings for physical therapists are projected each year on average over the decade. So this is definitely a field that you would want to get into for sure. Did you also know that MCPHS celebrated our 200th year anniversary back in 2023? We started in 1823 as the oldest university in Boston and the second oldest pharmacy school in the country. Did you also know that MCPHS has over 7,500 students enrolled with representation from all 50 states as well as 74 countries? And last but not least, we have clinical affiliations with the world leading medical institutions, which this is just a drop in the bucket as far as how many affiliations we have. But on our screen, we do have Brigham and Women's Hospital, Mass General, as well as Boston's Children's Hospital. And like I said, just to name a very small portion. So why MCPHS? Well, recently we were ranked number 5 in the nation for return on investment, according to new updated data from Georgetown University Center on Education in the Workforce. MCPHS is also ranked number 2 in both Massachusetts as well as New England region, second only to MIT. And so at the bottom of the screen, there's a quote from Dr. Craig Mack, who is the Associate Provost for Student Achievement and Success. So we are definitely excited about this ranking, and we are really appreciative of all the hard work that our faculty and staff put into making sure that NCPHS has such a impressive ranking, I should say. So definitely excited about that. All right. So when we're talking about MCPHS, what I really like about us, which sort of sets us apart from some other graduate schools, is that we offer graduate level housing. And on this screen, you'll see that there's some information about our housing units. So our Worcester campus is a campus that does provide on-campus housing to any students that are interested in it. There's a level of convenience in that we offer a variety of different types of housing units, whether you're looking at a studio apartment, a condo type of apartment, or even a suite level of apartment, as well as even a hotel room type of housing unit that we offer as well. So we do have a 24-hour fitness center that's located on our campus. We do have plenty of study spaces that are available, computer labs, and then we also have a public safety team, which is dedicated to your safety, because we do provide a lot of services to the community, and our campus is open to people from the community. We want to make sure that we have a very strong presence from our safety team, and they are definitely dedicated to making sure that you have a level of safety on our campus. All of our housing units are competitively priced, and you'll find our housing rates on our website. The thing to remember is that the utilities are included in the rent, and it comes fully furnished. So the big furniture items are provided to you by the university. So you would just need to bring your personal items. And I want to turn it over to John and Vincent just to find out if you have lived on campus or currently living on campus, or if you are a commuter, and any information that you want to share with our attendees at this time. We'll start with you, John, and then we'll go to Vincent.
All right, so I am on campus living in 379 Main Street, which is one of the options. The room is pretty much laid out like in that bottom picture right there. It pretty much exactly like that. Uh, a little further into the room, like right behind where you see that tile floor, there's a kind of cooking station with 2 burners. There's a fridge. It's a very kind of comfortable. It's not too cramped. There's also your own bathroom, shower. Uh, I there are options for like larger apartments with roommates in 379 Main Street, but as for me, I'm in a solo apartment, and it's majority of my classes are maybe within a 9-minute walk. It's just right down to Lincoln, which is a very comfortable walk. Never had any issue with any type of safety or anything, although the campus provides excellent services in that regard too. Uh, as well for the fitness, it's right down the street. If that doesn't cover all your needs, there's also a Planet Fitness less than 5-minute walk away, which I take advantage of. And uh, while living in Main Street, I've had no issues. It's not having to worry about a commute, and not really having to take in that aspect, as well as having my car on campus, which the garage is maybe a 10-minute walk as well, has made it very easy just to stay kind of locked into the program and stay on task while going through graduate courses, which can be stressful, but the housing is great here. I really can't sing its praises enough.
I agree with John that the housing is pretty good in Worcester. I live in Lancaster, which is about an 8-minute walk from campus. It is an off-campus housing apartment, two-bedroom apartment, but it's through the school. So you pay the rent through the school with that. I do live with the roommate, but I requested the roommate that I am with before I started the program. It has a full kitchen, full bathroom, full living room, two bedrooms. So my roommate and myself get our own bedroom, and also has on-site parking lot, which is very convenient for my apartment, and I don't regret it at all.
All right. And they were not paid to say this, by the way. Like, this is their honest opinion about housing. So I was just kind of joking with that. But in all sincerity, we are really proud that we're able to offer this to our students. And the rent is charged once a semester to your account. So there isn't any separate, rent that you have to submit for housing. So thank you, John and Vincent, for sharing about your housing experience. All right. And from there, we are going to turn things over to Dr. Powers. She's going to share with us about our program and its structure. So I turn it over to Dr. Powers.
Great, thank you. With our program for PTs, ultimately, we're trying to build successful clinicians. That includes changing our curriculum to be as contemporary as we can be. We then turn you over to clinical application. We make you use that material right away with our integrated clinical experiences. And then further building this successful clinician, we have many opportunities for informed self-reflection throughout the program, which help to foster your own growth and resilience throughout all of this. And then we rely heavily on our community to make a difference locally, but also to let you all get out into the field and practice your skills in working with people. So we have a lot of interprofessional collaboration and education set up. We have small student cohorts with strong student support from faculty and strong connections. So our program, we feel, is really well-rounded to develop the most successful clinicians. I think we lost the slides, Timmy.
Oh, no. Sorry, my computer has not been kind to me today at
That is
all.
okay.
I totally apologize, everyone. Give me just a minute here. Okay, are we back in up and running? Okay, perfect.
Yeah. So throughout the first year of the curriculum, you're getting a great sense of the musculoskeletal system. You get to begin providing PT to members of the community through the integrated clinical experiences, as well as our on campus Balance Wellness and Movement Center, which is a wonderful opportunity to work with all of those community members. In the second year, you'll be more exposed to the cardiovascular and pulmonary and nervous systems, with complex case integration to kind of wrap things up before you proceed into the third year, which is your off-campus full-time clinical rotations. So, good. These clinical rotations are matched to suit you, right? You need to have one performed in an outpatient orthopedic type setting, one performed in a complex medical rehab setting, such as an inpatient acute or a subacute rehab or a home care. There's lots of ways to check that box in ways that suit you and your needs. Then your third rotation is more of a specialty for you, where your interests lie, be that sports or pediatrics or outpatient neuro. We really try to tailor that within our database of more than 300 clinical contracts across the country. So your clinical education package is really tailored to your needs, your wants, and your desires, however they may change as you go through our curriculum. We have a lot of support for student growth within the School of PT. You're assigned a faculty coach. You have many professional and peer tutors available to you. Student groups have formed throughout the years, often known as flocks. And we also have a very supportive adjunct faculty to add to your experiences and supporting your growth throughout the program.
And if I can just interject, Dr. Powers, if John or Vincent, if you all can share with our attendees any experiences that you've had regarding the student support for growth in your experience so far.
Yeah, I can add to that. With our cohort, the first years, we have a group chat with just all of the students in it, and we kind of help each other throughout the week, just giving each other advice on how to do certain assignments or movements that we're learning in the classroom and lab. And it's very supportive. Everyone is not competitive at all. Everyone wants to see everyone else grow and be a better PT student overall.
Yeah, piggybacking off what both Dr. Powers and Vincent said, the flocks do form, and we do have a group chat and all that. A lot of that formed like the first day. I think during our first day orientation is when we created the group chat for all of us. And even though there is kind of groups of people that flock towards each other, more so, everyone is still very connected. Everyone, like Vincent said, wants to see you succeed. And with the faculty coaching or the professional or the academic coaches, they are also very open to talk to you about pretty much anything. You do meet with them twice a semester, once at the beginning, once midway through, and sometimes it's you're just having a conversation with them. If everything seems like it's going well and you have everything kind of figured out for the time being, easier said than done, I guess. But you can just conversate with the coach. And yeah, like you said, everyone's super supportive. Professors, coaches, students, everyone wants you to succeed at the program. So they're all on your side.
Right.
And then, excuse me, beyond the PT department, MCPHS has wonderful academic supports, career preparation offices, um, between the Center for Academic Success and Enrichment and the Office of Student Access and Accommodations. They can support you across the board with further learning strategies, peer mentoring, and academic coaching outside of the PT program. So the university is set up to support students as well. The integrated clinical education piece begins year one, semester one. We have you out in clinics as early as week 5 of the program. And you see listed on this slide some of the clinics that we do partner with. But that's a handful of the many places that you'll get to observe and or apply your care. So in the observation sites, you're really seeing how PTs work within that setting. But at an application site, you're delivering the care to the participants of whichever program. So in year one, that occurs fall and spring. In year two, that is fall, spring, and then that final summer semester as well. We have settings from acute hospitals to rehab hospitals. You'll see early intervention and school settings. For those that might be interested in pediatrics, you'll see a whole host of private practices, home care, as well as memory care units, and see how PTs can be integrated into that type of care as well. And then our Balance Movement and Wellness Center is on campus, but it's part of this integrated clinical education piece. Students begin working with patients twice a week, starting in week 5. The second year students are often mentoring the first year students as far as the care to provide, overseeing and advising, and setting up care plans. So the second year students in these scenarios get to perform the patient evaluations. They design and implement the plans of care. And all of this is done with clinical faculty oversight and mentoring. And then it's integrated within the curriculum so that you're applying therapeutic exercise. You're considering the cardiopulmonary system. Largely, you're working with a geriatric population. So you're putting all of those pieces together and really synthesizing that information. And all of this to that all important licensing exam. The National Physical Therapy exam is it's a big thing at the very end, right? You graduate and then you have to pass yet another test for your license. So we help to prepare you for that. We give you exam questions written in the style of this exam. You'll also have comprehensive exams building you up towards that licensing exam. We give you specified full-length practice exams with full question analysis. You'll also get a full 15-week content review in your final semester. We have lots of available resources for you, and we start all of this as soon as you get into the program. Another unique piece about being under this umbrella of MCPHS is the interprofessional education. We have many frequent events with students from other healthcare programs across the university for collaborative learning about real-world issues. You'll discuss topics such as cultural humility, the opioid use disorders, and health equity. You can see in the bottom picture listed here, these are students participating in a dementia sensitivity training. So they're learning how to live and how patients operate with those decreased sensations. So the goals of all of this is to learn with and from your peers within the healthcare disciplines so that you can approach these patient problems from a team-based type of collaboration. We can also bring research into your lives if that is of interest to you. Our faculty will provide many opportunities to actively engage students in the research. And we've had students presenting at the university, regional, and national conference levels based on their participation in research endeavors, which is always wonderful to see. And then within the School of PT, we have a service club, the PT Service Club. Their core value is to service both the community and the profession of PT. So this club tends to run local food and clothing drives for many organizations. They lead service projects and volunteer at events such as the Boston Marathon and other runs to support the runners. And then we have some partnered organizations. Camp No Limits is one where we send students to support children with amputations and prosthetics. And then in the upper right-hand corner, you can see some students participating in a jet pull for MS research funding. So they participated in that fundraiser heartily. We also now have some dual degree options. Students that are successful through the first year of our program can begin the Master's in business health administration healthcare technology. So this MBA courses are offered online. They can be taken at a distance learning format. We have some requirements of GPA and things that need to be maintained to take advantage of these options, but they're great options to have.
Right. Thank you so much, Dr. Powers. Was there anything else you wanted to share, or you think you pretty much was able to get everything?
I think we've covered everything, Tammy. Thank you.
Okay, great, great. So, when it comes to missions, of course, that is my area of participation in the process. So, just to let you know, we are currently still accepting applications. You would want to submit your application via PTCAS, which is the Physical Therapy Centralized Application System. A bachelor's degree needs to either be already earned or expected prior to matriculation. You need to submit all official college transcripts. We look for a minimum overall GPA of 3.0. You need to have at least 10 hours of PT shadowing experience, and you need to be able to provide proof or documentation that those hours have been completed. If you have any missing prerequisites at the time you apply, we will allow you to finish those prerequisites, but they must be successfully completed prior to August 1st of the year you're starting. So if you're applying for fall 26, those missing prerequisites must be completed by August 1st of 2026. You need to submit at least 2 letters of recommendation, although we do prefer to receive 3. And if you have any international transcripts, you need to make sure that you also submit that transcript evaluation, preferably through WES, which is a company that will evaluate your transcripts for you. The deadline to apply is June 3rd. So that is literally right around the corner. So you do not want to delay. Also, MCPHS will pay your application fee for you if you're applying for fall 26. So that is definitely a perk for you to get that application submitted. If you need a fee waiver code, just let me know and I could send that code to you, which will cover the application fee. As I mentioned before, you definitely want to apply as soon as possible because we are on rolling admissions. And so seats are being filled every day. So you definitely want to get that application in when you can. And then keep in mind that June 3rd is the deadline to apply. When it comes to merit scholarships, we're offering a merit scholarship of up to $15,000 per year of the program. We're also offering $4,000 per semester for housing, which is great because that will cover a large majority of the housing cost. So you definitely want to take advantage of that because I'm not sure if that will be the case for fall 27, but for fall 26, this is definitely something you want to take advantage of. And we do offer affordability appointments through Lynn Berry, who is the financial counselor for PT, and he works in student financial services. Here's his contact information, but if you need that, I can also email it to you as well. You would just want to let me know. And that concludes our presentation for today. This is my contact information. You can take a picture. Um, this is my Calendly link. So if you ever want to schedule an appointment with me, I am more than happy to meet with you at any given time, whether it be virtual or by phone, and I can answer any questions you have. So I look forward to hearing from you. And when it comes to our social media presence, we do have an Instagram presence. So you can take a picture of this and definitely, if you're on Instagram, take a look at what our students are currently accomplishing. Um, and we would love to entertain any questions from you at this time. You can put them in the chat or the Q&A section at the bottom of the screen. So, any questions? Well, if there are no questions, that will conclude our presentation. I want to thank you so much for joining us this evening. And if you are looking to apply, definitely get that application in and let me know if you need that fee waiver code. Before we go, though, I do want to end with some closing words from Vincent and John. Vincent and John, if you all could give our listeners just one piece of advice if they are maybe admitted but haven't deposited yet, or they haven't quite applied yet, or maybe they're deposited and they're going to be starting because there's a lot of different populations. Just one piece of advice, and then that's how we'll close.
Uh, to start off, I would just say just find the studying strategy that works for you. You don't need to go in like reviewing muscles. You'll learn everything while you're in the program. Just find which strategy works for you and stick to it and be able to just what helps you retain information and what helps you learn the information.
Yeah, if you're going to this program or another program, I would say enjoy the summer. Starting PT school is very exciting, but it can also be very scary. But that's totally normal. But yeah, just have a good summer and then just be ready to start.
Excellent. And I'm so sorry, Janine, that you did pose a question, and I definitely want to entertain that before we go. So that is totally my fault. Um, you would like to know, do all prerequisites need to be within 10 years of bachelor's? So science and math courses must be within 10 years of the year you're starting. So if you are applying for 2026, we can only go back to 2016. Anything prior to 2016 for science and math courses, unfortunately, cannot be accepted. You would need to retake those. Now, your bachelor's degree doesn't need to be within 10 years, but those prerequisite courses in science and math must be. And then you want to know, what is the acceptance rate? I don't have that information updated. Dr. Powers, do you have an updated or no an acceptance rate? Okay, so Janine, what I'm going to have to do is I will get with my director to get an updated rate for you and let you know. The last time I had an acceptance rate, it was at 96%. I will give you a more definitive answer and I'll email that to you. And then your other question is, does the program begin with the fall semester? Other colleges start as a summer semester. So our program does begin in the fall. So your first class, if you're starting in fall 2026, classes begin September 2nd. Okay, so hopefully that answers all of your questions. Thank you so much, Vincent and John, for that amazing advice. To all of our attendees, thank you, Dr. Powers, for giving us your expertise in physical therapy. You are like so amazing, and I just hold you in such high esteem with your knowledge of physical therapy. It just astounds me. So thank you all so much. And thank you again for joining us. Have a good night. Bye bye, everyone.